Alright, we're live. Let's go.
Hello, this is Alvernia Live Chat, and we are now live across Facebook, Instagram, and TikTok. I'm Dr. Oh Jen Jen. I'm an emergency medicine specialist and head of Mount Alvernia Hospital's 24-hour urgent care center. Thank you so much for joining us during your lunch hour. So today, the session is called The Prepared Parent, Guide to Urgent Care for Common Pediatric Illnesses and Injuries. I will share with you what an urgent care center is about and how we're different from primary care and emergency departments. We are also taking questions live, and we have some pre-submitted questions as well. So please send us your questions and we will try our best to answer them today. So I will start off with some background information on urgent care centers. For acute medical care, where patients go to hospitals for sudden unexpected illnesses and injuries, acute care falls under a spectrum. On one end of the spectrum is primary care. So this is general practitioners, polyclinics, as well as pediatricians who can manage mild conditions at their clinics. At the other end is emergency departments. These are at restructured hospitals, and pediatric EDs are based at KK Hospital and National University Hospitals. These are departments that can manage serious to life-threatening conditions. So urgent care centers fall in the middle of this spectrum. We manage mild to moderate pediatric illnesses and injuries, which require timely attention but are not life-threatening. And also urgent care centers have access to on-site services like laboratory, radiology, as well as different specialists. So we can do investigations, we can refer you to specialists, sometimes if you need specialized procedures, and also because UCCs are based within hospitals, we can also admit you directly to our wards. So what are the general conditions that can be seen by GPs and pediatricians in the primary care setting? For mild conditions, you have the usual fevers, cough and colds, mild vomiting and diarrhea, and mild injuries. Then the doctors will assess your condition. If they feel that you need a referral to a hospital or the ED, they can do that for you. Some GPs and pediatricians also have access to laboratory and radiology services, but the turnaround times might be 24 hours or longer. So if you have a regular doctor, you might want to check with them on that. So when do you go to the A&E? This is at the other end of the spectrum. For very unwell babies and children, some examples would be very severe breathlessness, where your baby or child is noted to be in distress. They really cannot breathe, they are turning blue, they're very drowsy. Sometimes if they are having multiple seizures, persistently drowsy in between seizures, unresponsive, and if they're having severe or persistent pain, might be tummy pain, or in the case of male babies or boys, they may have testicular pain. So if it's severe and persistent, you should bring them to an ED. For urgent care centers, so if your child doesn't fall into either of these categories, mild or severe life-threatening categories, you can bring them to a UCC, either as a referral from your GP or pediatrician, or many cases the parents just come in directly on their own. So mild to moderate symptoms might be high fevers, not responding to any of the medications that are given, prolonged fever more than 5 days, not responding to any antibiotics for at least 2 to 3 days, any signs of dehydration, if there's poor feeding, especially if they're drinking less than 50% of the normal amount, if there's persistent vomiting, they can't keep anything down, if they're passing less urine, the diapers are very light, they're not passing much urine the whole day, and if they are persistently lethargic. Other symptoms of concern would be breathlessness but not in distress, and recurrent or significant abdominal pain. For injuries, you can consider an urgent care center if an X-ray is needed. For example, if the injured site, there's a lot of swelling, pain and bruising, the child is unable to move the joint or the limb, unable to walk or wait there. And for head injuries, if there's complaint of persistent, significant headache, multiple episodes of vomiting, giddiness, unable to walk, if there's some confusion and a change in behavior, and if there are wounds, if the wound might need closure with glue or stitching. If you're unsure, or if your primary care physician is unavailable, like outside office hours, you can consider bringing them to the urgent care center. Okay, so for those who have just joined us, let me introduce myself again. I'm Dr. Oh Jen Jen. I'm an emergency medicine specialist with Mount Alvernia Hospital's 24-hour urgent care center. And today's live chat session is the Prepared Parent, and a guide to urgent care for common pediatric illnesses and conditions. I just gave a brief introduction on what urgent care centers are compared to primary care clinics and emergency departments. Okay, so we have a new question on Instagram from Kai Shan. If my baby swallows a foreign object, is it appropriate to visit an urgent care center? So for this, it also depends on how your baby is after swallowing the foreign body, because most of the time the foreign body is swallowed into the stomach and may not cause obstruction. So if it doesn't cause obstruction and your baby is still quite well, you can consider bringing to a primary care clinic first, preferably a pediatrician. So if it's during office hours, your pediatrician is available, you can consider going there first. If it's outside office hours and the baby is well, please go to an urgent care center for further assessment. So how do you tell if your baby is unwell? If there's choking, the baby is unable to breathe, so turning blue, becomes unconscious. If that happens, that is an emergency. Please go straight to an emergency department. If you're not near a hospital, call 995 so the ambulance can bring your child immediately. So if your baby is well, you bring to and you decide to go to an urgent care center, we will do an assessment, make sure there's no red flag symptoms or signs, and usually we will consider doing an X-ray. Yeah, but whether it appears on an X-ray also depends on what the object is, because some objects may not appear on X-rays. So thank you for that question. We will go on to some of our pre-submitted questions now. Baby Cola on Instagram asked, when should I call or when should I see a doctor if my child under 1 year old has a fever? And how do I decide whether to take my child to urgent care or go to the emergency room? So for infants, those below 1 year old, this also depends on a few factors for both babies and children. The age, the parents' own experience, caring for a child with fever, the parents' level of comfort, and the timing, whether it is outside office hours, over a long weekend, public holiday, when your regular GP or pediatrician is not available. Yeah, so if it's an infant, if anyone 3 months and below with a fever of temperature 38 and above, such cases usually will require admission. So if your baby is in this category, you can still see your regular pediatrician, but there's a chance that the pediatrician will advise admission. Yeah, but if it's outside office hours, you can go to an urgent care center. Just make sure that your baby is still quite comfortable, still able to feed at least 50% or above, not very breathless or in distress, not turning blue, not very drowsy, unarousable. Yeah, if the baby is quite stable, you can consider going to an urgent care center first. Alright, so we have another new question from Facebook by Summer. If my child has asthma attacks, vomiting or allergic reactions, can I visit the urgent care center, and what are the hours? Okay, for hours, for Mount Alvernia Hospital at least, we are open 24/7. Right, so we are accessible all the time with doctors and nurses on duty. So you asked about a few different questions on asthma, vomiting and allergic reactions. Again, this depends on your child's condition, whether it is something life-threatening. So I mentioned some of the signs at the beginning during my introduction. If it's a potentially life-threatening, very serious condition, then you should go to the emergency department immediately. If it's something quite mild, if it's office hours, your pediatrician GP clinic is available, you can consider going there. But in between, quite moderate symptoms or outside office hours, you can bring to an urgent care center. Okay, yeah. So again, let me reintroduce myself if there are new joiners to the session. I'm Dr. Oh Jen Jen. I'm the head of the Mount Alvernia Hospital's 24-hour urgent care center, and today we are talking about the Prepared Parent, a guide to urgent care for common pediatric illnesses and injuries. Earlier I discussed what primary and emergency care settings are about, and what conditions are suitable for each setting, and what conditions you should bring to an urgent care center. Okay, so another question from Instagram: is the wait for urgent care center long? So I would say that for Mount Alvernia at least, our wait times are generally below 1 hour, but it depends on the caseload at the time you come and the time of the day. Usually weekends and public holidays tend to be more busier. So if it's busy, the wait time is expected to be a bit longer. Yeah, but generally it would be less than 1 hour to see a doctor. Okay, so let's go on to another pre-submitted question from Instagram. Travel Pinky asks, what should I do when my child has a seizure? Should I send my child to the ED? So for seizure, there are a few scenarios. One is this the very first time your child has a seizure? Or is your child known to have seizures before, like fever-related or febrile seizures? For those who have had seizures before, the parents are usually quite well educated on what to do when a seizure occurs. So if the parents know what to do, they're comfortable, they will know when to bring to the hospital. Yeah. So if it's the very first seizure your child has, most seizures tend to be of short duration. So it may stop after a few minutes. Yeah, and your child will be drowsy for a while, but may recover and become conscious after maybe 5 to 10 minutes. There's also the issue of what is the cause of the seizure. Majority is fever related, quite common in those up to 5 years old. And other causes would be head injury. So if your child fell, had some head trauma, or in some cases if the child accidentally swallowed something, either a liquid, a chemical, or maybe a pill, a medication that was left around the house. Yeah, so depending if it's a fever-related seizure and it stops after less than 5 minutes and the child recovers, anytime it's a first seizure, very first episode, never had it before, you should bring the child to see at least a pediatrician. If the child is well, it's during office hours, you can consider going to your pediatrician's clinic. If it's outside office hours, you can bring to an urgent care center. But usually first seizure, we will advise to admit for further evaluation. If it's a head injury or accidental ingestion type of seizure, you can still bring to an urgent care center, but if the child is quite unwell, having multiple repeated seizures, never regain consciousness in between, having some breathing difficulty, turning pale, blue, sweaty, then please call an ambulance, or if you're near a hospital, bring directly to the hospital. Okay, so let's go to another Instagram pre-submitted question from Serene Wang SH. My child has a nosebleed that won't stop. Do we need urgent care? So for nosebleeds, I would suggest that you try some first aid measures first. So if there's bleeding, you can pinch the nose, meaning the soft part, pinch it tightly and close the nostrils for at least 10 minutes continuously. And after 10 minutes, you check and see if the bleeding has stopped. Most nosebleeds will stop with compression for about 10 minutes. If it doesn't stop, you can repeat for another 10 minutes of compression, and you can do this up to 3 times and see. If after 3 cycles or half an hour the bleeding doesn't stop, if it's outside office hours, you can go to an urgent care center. Yeah, if it's during office hours, you can consider going to your pediatrician first. But sometimes the pediatrician, may decide to refer to an ENT or ear, nose and throat specialist. For urgent care centers, if the bleeding stops and doesn't recur, we may refer, if it's outside office hours, the ENT clinic is not available, we may refer to the clinic the next working day. If the bleeding continues or is recurrent, we do have access to on-call ENT specialists, and we may ask them to come back and see your child at the urgent care center. Okay, so there's a question on TikTok. Can urgent care handle stitching or broken bones in children? Yeah, so for urgent care, as long as it's not something serious or life-threatening, we can do procedures like stitching, glue, and also manage fractures. For example, putting casts. We have to assess the degree of the injury. More complex injuries will be referred to a specialist, for example, pediatric orthopedic surgeon, or a pediatric surgeon or plastic surgeon if it's a deep facial wound. So we can see such patients, and some are managed at the urgent care center. Okay, on Instagram from Amy K. What are the signs of dehydration I should look out for? So my nieces don't like to drink water, and I worry they may get heat stroke or dehydrated. Okay, so this is more of a general question, so I will just give you some basic guidelines. Signs of dehydration would be if they are not passing urine well, not just the frequency, but also how much urine they're passing and the color of the urine. Yeah, so in general, I think most would pass urine every 4 to 6 hours. So that maybe is about 4 to 5 visits to the toilet a day. And you should also try to see the color of the urine, whether it's light yellow or clear. Most of the time it's light yellow, very rarely it's clear, and also how much urine they are putting out. Yeah, of course in hot weather, we do need to hydrate more, and yeah, the amount would also depend on the exact age of your nieces. Okay, yeah, so another quick introduction if you are just joining the session. This is a live chat on the Prepared Parent, a guide to urgent care for common pediatric illnesses and injuries, and I'm Dr. Oh Jin Jen, the head of Mount Alvernia Hospital's Urgent Care Center. Okay, so questions from Instagram. Someone says that she was turned away from a hospital near her home and referred to KK Hospital because they don't have pediatric emergency doctors. So does the urgent care center have pediatric specialists after work hours? Okay, so this hospital, I'm not sure which hospital it is, but I have heard of some urgent care centers or private hospitals not being comfortable managing pediatric cases. So that also depends on the type of doctors they have on staff. Yeah, so if they are not comfortable, it is reasonable for them to refer you elsewhere. They sometimes refer you to KK Hospital, but this session is also to increase the public's awareness about the availability of urgent care centers that can actually manage pediatric cases quite well. Yeah. So does the urgent care have pediatric specialists after work hours? Depends on what kind of specialists you mean. Our urgent care center, it is not run by pediatricians, but we have on-call rosters. So we have pediatricians and pediatric subspecialists in orthopedic surgery, plastic surgery, pediatric surgery, neurosurgery, ENT and eye specialists who are on call. They are not on site, but we can call them back after office hours, even in the middle of the night if needed, and they will come down to see your child if they need a specialist review. Okay, so we have 7 minutes of the live chat session left. So please submit your questions if you can, so that we can answer them before the end of the session. Okay, so let's go to another pre-submitted question. Yeah, so there was another question about the typical wait time if it's an emergency between 9 p.m. and 12 midnight at our urgent care center. As I mentioned before, the wait time does depend on the caseload at the time that you arrive. Weekends, public holidays tend to be quite busy, as well as certain weekend evenings after 8 p.m. It's quite busy. Yeah, and so if there are many patients already waiting to be seen, then the overall waiting time will increase a little. Yeah, but most of the wait times to see a doctor is less than 1 hour. If it's an emergency, like a child who comes in having an active seizure, very breathless, and noted to be very unwell, all patients at the urgent care center are triaged upon arrival. So that is a step. When they arrive, one of our nurses will assess the child, and if the child is noted to be in critical condition, we will see that child or baby immediately. So you will not have to wait at all. Yep, we will bring them to our resuscitation room and start treatment and intervention immediately. Alright, so 2 questions from TikTok. From Mitch L. If my child gets a rash due to food allergy but no breathing difficulty, do I need urgent care? So if your child is generally well, just having a rash but no airway issues, so not breathless, no wheeze, no noisy breathing, if it's office hours and your pediatrician or GP is available, you can go to the primary care clinic first. If it's outside office hours, you can bring to an urgent care center, as long as your child is comfortable. So from Agnes, can Mount Alvernia do emergency imaging like x-rays or scans for children? The answer is yes. So if you come to the urgent care center, we will have a doctor assess your child, and we will advise regarding whether any imaging is required, what kind of imaging, and the pros and cons and so on. And these services are available 24/7. Alright, so as we end our live chat session, I'm asked to share some general thoughts on urgent care center for pediatric patients. So I would just say that sometimes it's very difficult for parents, especially if you're a new parent, to assess whether your child is mildly ill, seriously ill, or somewhere in between. So this session is meant to give you a general guide on how to tell what kind of medical service you need, and also outside office hours, aside from the emergency department, just remember that urgent care centers are available, but just maybe check if the urgent care center that is near your home can see babies and children, because of a previous question that they went to a hospital and they were not able to be seen there. Okay, so there's one question from Felicia on Instagram. Can you share what kind of conditions we definitely have to send to an ED instead of the urgent care center? At the earlier part of this chat, I did mention that emergency departments are ideally for very serious, critically ill or life-threatening conditions, and some of these signs that you might see in your baby or child are very, very severe breathlessness. The child is having a lot of difficulty breathing, may turn blue, drowsy, or unresponsive. If there's a very prolonged seizure, more than 5 to 10 minutes not stopping, or if there are multiple seizures, recurrent seizures, and no consciousness in between the seizures, if your child is very confused, drowsy, not waking up at all, feeding very, very poorly, turning pale, limp. So if any of this happens, you should bring to an emergency department. Yeah, and if it's an injury, for especially head injuries, if your child is becoming very drowsy, so meaning that they are unarousable, you're trying to wake them up and they can't wake up, or they become confused, they're not their usual selves, and having seizures, etc. Yeah, you should go to an emergency department. Okay, so we are going to end the chat session now. Thank you so much for joining us, and we had a lot of fun answering all your great questions. Thank you. So if in case you missed this chat earlier, we will also share some clips from this session on our social media platforms. If you need if you have any specific questions or need specialized advice, feel free to reach out to us. You can drop us an email with your questions, and we will get someone to reach out to you. Yeah. So please continue to look out for our next live chat session details on social media, Facebook, Instagram, and TikTok channels to stay informed. Thank you very much, and hope to see you again.